Uh, my name is Adam Harvey, he, him pronouns with the Washington County Hope Center and co-chair here on the HSSN network. And as you're logging on, I want to invite you to take just a moment to put your name, your agency, and pronouns in the chat. And also, as an icebreaker, as you have the chat open, and we got to experience our first 90-degree weather day yesterday. Maybe share with the group here something you're looking forward to this summer, trip, concert, whatever. Yeah, just share out what you're looking forward to. Spending time on the river, hanging out with a 5-month-old. That sounds like a lot of fun. Camping. Yeah, lots of great plans. Mountains and rivers, vacations with the family. Lots of great plans, it looks like, happening this summer with our network. Good for you guys. Hey, well, I'm gonna go ahead and get our meeting going and keep us on our agenda. Just as a reminder, there's two different avenues for our membership to provide feedback or comments on our houseless systems. You can submit a comment from the link to our HSSN webpage, and you see the link was just posted there in the chat. Standing public comment item has been added to our monthly agenda. Comments are limited to 2 comments per meeting at the designated time, each given 2 minutes. The co-chairs will work with county staff should the public comment process need refinement. To request and make a comment during this meeting, you can direct a message via chat directly to Lindsay Dent by 8:45, so here in the next 10 minutes or so. Include a quick topic and description and the organization you represent. We take the first 2 received and provide opportunity to speak for 2 minutes. And additional comments can be submitted through the online public link. Just as a reminder, if you have content that you would like to provide, we don't use the public comment section for that, but you can request time on an upcoming agenda. So public comment information. And now I'm going to pivot to Katie for some programs update.
How about now? Great. We love the switch between Zoom and Teams. Hi all, Katie Gentry, she, her pronouns. I'm the homeless programs manager at Washington County. I have a few quick updates for you all. The first and biggest one is the Continuum of Care Notice of Funding opportunity was released by the federal administration earlier this week on Monday. We will be running our local competition starting next Monday, June 8th, and that will be open for 3 weeks. For applications. So anybody who's on the HSSN listserv will get notification of that release of that notice of funding opportunity that is available. We'll be accepting applications. The focus of the applications is really going to be on transitional housing and supportive services only projects. But all of the details for that request for proposals can be found in the document, and we will send out information to this group. It is not much different than the NOFO that they dropped earlier this year in November and again in December, but there are some unique differences. And so we're working through processing kind of what are those changes and do we make any changes to our request for proposal coming online. If you are a renewal applicant, we will also be following up with you. That application will, we will be working with you through June and early July, and then we will have our procurement subcommittee come together in end of July to make decisions before that submittal in August. So a lot of busy time for that federal funding right now. The other big procurement updates that I have is we just awarded a case management RFP for permanent supportive housing for a project in Forest Grove. That project is still 2 to 2.5 years away because it is a full construction project, but huge congratulations to Transcending Hope for getting that award for it's going to be a behavioral health focused permanent supportive housing project for 45 units in Forest Grove. Two other big updates from a procurement perspective. This summer, we will be releasing two different, one NOFA and one request for proposal. The NOFA is going to be for a Beaverton Access Center. So if you're interested in acquiring a building and running an access center in Beaverton, look out for that NOFA that will be hitting in middle of June to early July. That will be released on OpenGov, and again, we'll send notice through this listserv. And then we will also be procuring a contractor for our Hillsborough Bridge Shelter to take on all of the operations and also facility management of that contract. So that has been, Washington County has been doing the facility management of that building for 5 years, and we are looking to have that be more in alignment with the rest of our shelter operations, having that all under a nonprofit operator. Okay, I think that's all my procurement updates. Contracts. If you have a contract with Washington County, we are getting this through the signature process. So if you're an executive director, please be on the lookout for those. We're trying to get everything signed by July 1, and they are making their way through our internal process and should be out to you all by end of next week. So please be on the lookout for that so that we can get those moving by July 1st. And I think that the last two big things is we are running community engagement for two projects right now. Our first being the Safe County, nope, Central County Safe Rest Village, new name coming because that is quite choppy. And that project will likely open in July. We just finished our last community engagement 2 weeks ago, and it went really, really well. We're really excited for that project. That open door will be running in Central Aloha. And then our Cornell Road project, which is a transitional housing project for people in recovery, will be opening likely in October. We are running community engagement meetings. Our next one is June 17th. If you are interested in attending or want more information, please send us an email. And that project will be opening in partnership with Helping Hands. Okay, I think that is all my updates. Adam, I'm going to pass it back to you, but happy to stay on the chat and see if anybody has any questions for me.
Great. Thanks for the update, Katie. Okay, we're gonna pivot into our presentation time. Zakir, you're good to go and take it away on HR1 and medical expansion.
Great. Good morning, everyone. I'm gonna try to share my screen here. Let's see. Here we go. All right. So today I'm going to be talking about HR1 impacts to healthcare in Oregon. And as this group might be familiar with, there's a lot of different people that are sitting at the margins here in Oregon. And the top line takeaway that you should have from this presentation is that those marginalized individuals are going to become more marginalized underneath HR1. And as we'll see in the slides to come, there's just a lot of content regarding the subject matter. And I've included a lot of extra slides within this deck to share with you. I'm not going to go through all of the slides, but I want it to be sort of over informative because there's so many different things to understand about this measure. For background on myself, my name is Zakir Khan. I am a government relations manager here at Washington County. As part of my main portfolio items, I cover health and human services. So that includes everything from the director's office for all of the sub sort of divisions and departments within them. I also cover labor issues for the county as well, and a host of other kind of smaller portfolio items. I will say I'm not an expert on HR1. That's one main thing that I'll start off this presentation with saying. There are just so many bits that every time I sit down and I do this presentation for people, I'm still learning about the bill as I go through it. So with that said, one thing as another top line to know from this measure is that Oregon will see a $10.7 billion reduction in Medicaid over the next 10 years. So today I'm going to be talking about sort of a federal overview of HR1, and then I'll be talking about state and Washington County impacts. So this is a really key slide that contains a lot of sort of critical information about the overview. And if there's like one slide that you want to kind of maybe potentially like print on your wall, just if anyone's going to be asking you about HR1, this is a really good slide to sort of keep handy. So it cuts over $1 trillion from Medicaid and ACA coverage over 10 years. And the key provisions include national work requirements, copays, and stricter eligibility rules. So, they're highlighting this funding for rural health, but that funding for rural health does not offset the amount of cuts that are coming to Medicaid is a key point to make. And then there's steeper cuts to provider tax rates that we're going to be getting into in the slides to come. But all of these things essentially end up with the impact of 11.8 million more people uninsured by 2034. There's a lot of eligibility requirements that have to be happening on a 6-month basis. And so that could cause disenrollment, especially people who are sitting in more rural spaces where maybe access to work is not as readily available. And even, within urban areas, as we're seeing in Oregon with the unemployment rate, having a role that gets you enough hours so that you can qualify for Medicaid may also be a challenge. There's also rural facility gaps despite that funding support, which doesn't ultimately amount to very much. And then the copays may increase for all people because of an increase in Medicaid patient costs. So with regards to this slide, state provider taxes. So states fund their portion of Medicaid through provider tax rates. HR1 specifically reduces that tax rate for expansion states like Oregon. And so what you end up having is like there's less money that the state can draw from those provider taxes. And so they're not able to fund their portion through those taxes. And so they have to be able to identify another way to fund that portion. So the lower cap on state-directed payments basically means that the states have a payment that they provide to providers, and this creates caps on that. And they've created these caps, they're saying, for cost control. But basically those payments are made under Medicaid managed care contracts. And so we're going to be seeing, less money being able to be provided for that as well. A couple other things I'll be covering from the slide is the Medicaid work requirements. You're seeing on there that there's conditions on the beneficiaries working or engaging in activities for qualifying at least 80 hours per month. And I'll detail the work requirements later in some future slides. They talk about the rural health funding. So we now have that number that's kind of been declared via the Oregon Health Authority, which is that the state will be getting $197 million over 4 years. And so it's $100 million in base funding per state. And then they've been able to obtain $97 million from a grant. And that's to be used for short-term projects and long-term projects. So some of the long-term projects are related to workforce for rural communities and new technology. And then you've got some funding that can be directed towards preventative healthcare. So we'll be talking about Medicaid. I'm not going to cover every single item that's within these slides because there's a lot going on. But you can just kind of see that, there's a lot of different incentives that were being offered to the community in prior iterations of Medicaid that are now going away. And so there's a reducing incentives for non-expansion states to adopt the Medicaid expansion. With regards to the FMAP, it caps the federal matching payment at the state standard FMAP rate for emergency Medicaid services provided to individuals who qualify for Medicaid or are ineligible due to their immigration status. And so the impact there is that there's potential for reduced emergency Medicaid services provided to ineligible immigrants. With regards to the work requirements, so this mandates that states require people aged 19 to 64 to work or engage in qualifying activities for at least 80 hours per month to be eligible for Medicaid. It exempts parents with dependent children aged 13 and under, and requires verification of compliance prior to enrollment and periodically during coverage. And so you're going to see in a couple future slides here that ODHS as well as OHA kind of detail how they're working to implement the law, but essentially the state now has to commit resources towards those eligibility checks. And so as a result, there's just a lot of money that has to go to supporting those eligibility checks. And so the impact there is that there's a potential or there's going to be reduced Medicaid access for individuals who are unable to meet the work or reporting requirements. And so there's penalties upon states who don't properly analyze who is being eligible for Medicaid or not. So states have to do things at a 6-month cycle, basically, twice a year, tightening the current 12-month renewal schedule. And so the impact there is increased risk of coverage disruptions to more frequent renewals and supports more timely updates on enrollees' eligibility status. Go to the next slide here. With regards to immigrant coverage, it limits Medicare eligibility to U.S. citizens, lawful permanent residents, certain Cuban and Haitian nationals, and COFA migrants. And so this is the loss of coverage for non-citizens who don't meet the new eligibility criteria, including individuals with temporary protected status, refugees, and asylees. And then with regards to section 1115, you're seeing it kind of got cut off in the slide, I think. Actually, I'm putting the slide up where I'm supposed to be. But that was the previous one. Let me go back. Requires the chief actuary from CMS to certify that certain 1115 waivers will not raise federal spending to baseline costs. And then with regards to state-directed payments, requires HHS to cap the state-directed payments for inpatient hospital and nursing facilities. So the ultimate impact of this is that you're going to see reduced supplemental payments to hospitals and nursing facilities, potentially impacting provider revenues and care delivery. This also has, subsequent impacts for hospitals. A lot of hospitals are, coming to the state in the wake of HR1 and saying, what's going to be the backstop with regards to how the state is going to support some of these hospitals that are going to be struggling underneath HR1. And so I know the state has created a plan for how they're going to be dealing with HR1. I'm going to be talking about that on a couple of slides to come. But there's also an individual who's working at the state level towards understanding all of the impacts and then coming up with a sort of mitigation plan. And so, my work for the county really operates on a state level. That's the bulk of our portfolio. There's some federal work that we do, but we also have federal lobbyists in DC. And so the critical question that I've been having with a lot of legislators over the interim, I was just speaking with Rep. Sanchez earlier this week, who is one of the co-chairs of Ways and Means, is what is the state's plan for how they're going to be dealing with HR1 impacts? And so there is a sort of plan that's being developed. And so we might see, significant changes to the way things have been always done with regards to Medicaid. There's been discussions that, we might go to an open card system, so a fee for service model, rather than utilizing the CCO model as substantially as they have in the past. That's still sort of waiting to be seen how that's going to play out. And so there's just a lot of different impacts that this has had. Hospitals have come to the state and said, how can you potentially backfill us for the funding that we're going to be losing underneath HR1 and loss of Medicaid dollars? And so those conversations are still ongoing, but there are critical conversations taking place about revenue for the state as a result of these healthcare impacts. And so with that, I'll move to the next slide here. There is, that additional rural health funding that the state was able to obtain, but it's not enough to sort of offset the impacts of the overall measure. So I'll be spending a little bit of time here now talking about Oregon analysis and impacts. And there's a lot of these slides are very text heavy. So again, I'm not going to be covering everything, but I just wanted you to be able to see what implementation details look like for the state. And this is a slide that ODHS and OHA have put together. I'm kind of borrowing from their slide deck as I enter this portion of things, but you can see how some of the items are being implemented over time here with regards to back in 25, some of the things that they had to implement. So a key provision there at the bottom of July 4th of 2025, Planned Parenthood banned from Medicaid participation. And then the state had to apply for rural health funding. And so seeing as now we're in 2026, the state's administrative cost share has been increased from 50% to 75% coming up here in October. And then back in July, you can see the Planned Parenthood ban went into effect. And then in October, you're seeing how there's the end of the Medicaid CHIP program for certain non-citizens, and then the new provider taxes and increases before, that have been sort of prohibited that I talked about before. And then you can see into 27 how there's additional things that come online, how there's sort of limits that are placed upon the state, provider tax rates. So there's a lot of just different components of this that the state has to implement at a proper time. And so I just wanted to provide this chart. That's another chart to know when things are coming online. In terms of the areas of impact that the state has really articulated for the public to know about, and especially people who are practitioners such as you, is that for individuals and families, especially in relation to HR1 and SNAP, there will be less money to buy food and there will be more hoops to jump through. For eligibility workload, there's more work requirements, policy changes and training needs, client outreach and support. For cost shifts to the state, there's more administrative share increases and payment error rate and benefit cost sharing. And ultimately, for Oregon's food economy, this means less money to grocers, farmers, and other food workers, and increased demand on food banks and pantries. So with regards to some of the eligibility sort of requirements here, we can see that the impact is 310,000 adults will need to be reviewed for the work requirements or exceptions. For SNAP eligibility for refugees, asylees, and other lawful permanent present immigrants, we've got 3,000 individuals who will lose benefits, including refugees, asylees, and other conditionally allowed individuals. We're seeing on this slide, there's different people that are impacted with regards to SNAP, but ultimately, with regards to the standard utility allowances based on receipt of energy assistance, 29,000 households will see an average monthly benefit decrease of $58. And so, like I said at the top, the marginalized will become more marginalized underneath this bill. So whole communities of people admitted as refugees, asylees, or victims of human trafficking will lose SNAP. A 63-year-old will be limited to 3 SNAP months in 3 years if they don't meet the work eligibility requirements. Residents of frontier counties must also be consistent with that 80 hours of work a month. And so things are going to get really challenging for them because they might not have access to as many jobs out there in those frontier counties. People and families who have SNAP will lose SNAP or get fewer benefits. And people and families will be doubly impacted by the loss of food and also medical benefits. As we know, here in Oregon, 89% of people receiving SNAP are also enrolled in Medicaid. And as a result, hunger in Oregon will increase. So the state will have to pay, SNAP has historically been fully funded by the federal government. HR 1 establishes a new framework where the state has to pick up 15% of the costs. So Oregon's last error rate is 14%. Unless the error rate is reduced, Oregon will have to have a 15% cost share. And then it increases Oregon state financial obligation to administer SNAP from 50 to 75% of the total cost. These are just the work requirements. I'm not going to detail all of these items, but essentially you can see that there's different work requirements that are being placed upon people for both Medicaid and SNAP. These are just a nice group of slides to be able to examine what are the specific work requirements. And these details further into these slides. I know I got an alert earlier this week that I think one of the rules for the work requirements was still being finalized. So that rule will be coming soon. You can see here in terms of the implementation dates, the final rule determination, I think, is coming by earlier this week. And so we'll see what happens as a result of that. Wanted to share the slide so you can see the Medicaid and marketplace provisions and when they're coming online. Again, there's a lot of content here that I've shared before, but just keeping these implementation dates in mind. And then this is a Gantt chart in terms of how the state is reacting to things and how they're tracking everything that has to come online. I'd say the presentations that have been happening before the legislature have been really impactful from ODHS and OHA. They've really been working in partnership to really understanding the impacts of this new law and providing briefings to the public via the legislature has been really impactful. And so if you have an opportunity to go and watch how that implementation is going, I highly encourage you to do so. And so we're seeing rural residents, working families, people with disabilities, immigrants and refugees, families with mixed legal status, and caregivers being the most impacted by HR 1. This is just some more slides about the work requirements, kind of another way to understand them. I'm not going to go through all of these items here, but I do want to talk about the Washington County impact. In Washington County, 17,730 people are enrolled via the marketplace, and they will see an increase in their premiums. 4,588 people will lose their premium tax credits. There are significant costs that are being placed upon the state to implement this item, and we're seeing ODHS, the cost is $110 million. And then OHA is spending $162 million towards implementing the law. And so final tips and takeaways that I want to share with you is that one of the critical things that the public needs to understand is what is the impact towards HR 1 upon the community. And so what I would highly recommend is sort of inventorying your stories. As you're meeting with clients and individuals that are being marginalized as a result of HR 1, really gathering those stories is really critical. And then embed them within your presentation, especially as you're talking to state legislators or people from Congress. Really gather those stories and really, create a platform for those stories for how you communicate with other people to talk about how HR 1 is going to be impacting your specific clients in the communities you serve, and then also the county at large. And then share those with individuals. I think everyone is thinking this law is so new that they're not fully able to understand the scope of the impact. That narrative is going to be a really key provision. We actually had a meeting as part of the county with some staff who are working to understand some of the takeaways. And one of the critical questions I had for our staff that who were studying HR 1 is, how long is it going to take to unwind the damage that HR 1 is creating? And so that question is still, yet to be determined. Nobody really knows how both the state and also the country are going to deal with the impact of this law thus far. And so gathering those stories to being able to unpack the threads as to how this is going to be impacting people is going to be very, very critical for the future. And especially how legislators, state legislators think about, what do we fund? How do we create funding to support supporting marginalized communities in the future is really critical. And then, I know there's some Washington County staff here, but thinking about, developing a briefing for our caucus, both state and federal, about how these changes are impacting us. You can connect with me for more information. And then, we also have federal lobbyists who are happy to unpack these concepts and provide a briefing as well. And so with that, I'm just going to stop sharing my screen and happy to take any questions that you all may have. Again, I'm not an expert on it. A lot of the finer details, I'm really not good at answering those questions. But that's why I've included all of the information for my slides so that you can see what I'm able to provide. Yeah, no objection with sharing slides out. I think the more people that are aware towards having the slides can better understand it. Great, no questions for me. I'm thrilled with that. But thank you for letting me off the hook. I know it's a really complicated law, but I think narratives are going to be really critical towards supporting our community in the wake of that. And again, I just want to credit our federal lobbyists at Van Scoig Associates, ODHS, and OHA, who've really put together a lot of really critical information, content that I relied upon for the slide deck and the briefings that they provided to the legislature. They've been doing a very good job of communicating with the public as to how this is going to be impacting people, as well as some staff here at Washington County, Eva Haas and Megan Schiller. I just want to thank them for their help with these slides.
Great. Thank you. Thank you for your time and for the content helping inform and empower our network here. It's much appreciated. We're going to pivot towards our next presentation, which is actually going to be from some staff at Washington County in presenting a poll for this network. And so, Lindsay, I'm going to go ahead and hand it off to you.
Thanks, Adam. I'm trying to just take a beat and digest the information because it was a little tough to hear some of that. I appreciate you sharing that info. And I'm really grateful for the local and state efforts to understand and track all of the changes coming down the pipeline. So, just pivoting gears a little bit, we all know it's June HSSN, the last of the fiscal year. Next month starts our new fiscal year. Typically, we skip a meeting in July due to the adjustment with the county and several agencies closing the books and all of those things. But it's also the season for forecasting presentations. We've been meeting with our new planning team and co-facilitators about how can we really bring value to this space in a way that is meaningful and that you all really get what you need from it. And so I'm going to tap Martin to help me with this. Martin's going to display a few polling questions. It's not going to take a ton of time. Looks like the first one's already up. There is also going to be a survey with the same questions linked that will be posted in chat. You are welcome to share that out with your networks for people that maybe attend but aren't able to make it today. It is optional. If you do decide to send it out or have others complete the survey, if it could be completed and returned or completed by, I would say, Monday. I know that's a quick turnaround, but that will help us collect the data. With that, we're going to go ahead and launch the first question here. If you've not answered it already, how long have you been involved in HSSN? So it's less than 1 year, 1 to 3 years, or over 3. The second question, just if you're more of an auditory learner, I'll go ahead and read them. What best describes your role? So, or just the best description. You might wear more than one of these hats: case manager, outreach or shelter, administrator, supervision, person with lived experience, community member, or other. Third question is, what populations do you work with most? So, do you work mostly with adults, families, youth, veterans, BIPOC communities, LGBTQIA individuals, people with disabilities, people impacted by the legal system, or and/or survivors of violence? Um, so if you could narrow that down to one option, what would that look like? And then number four, finally, what types of HSSN presentations do you find most helpful? And you can select all that apply. Training and skills development. So that really is like developing skills, maybe providing a curriculum in more of a training structure, or is it community resource sharing? Maybe there's a nonprofit or an agency across the county that has a lot of resources to share out, programmatic and best practice updates and announcements. That's in my mind similar to like Katie's announcements or any other policy or procedural information at the county level. And then regional information and updates, so anything with Metro, maybe the SHS measure, and then finally peer-led topics or presentations. We understand and value the value of peer work and believe that, if there is people with lived experience that really would like to branch out more on the sharing of knowledge, then that'd be great. So go ahead and submit if you've not already. I think, Martin, have most people completed?
Yeah, it looks like we've got a pretty solid number of responses here.
Awesome. Okay, so what we are going to do is collect this data and analyze it and use it to help forecast for this next year. The last thing that I'm really hoping at least a couple of people are able to either unmute or put in chat is any other general feedback. What types of topics do you think would be most meaningful for either you or people coming to this network? Maybe specific presenters, or if you have attended a presentation recently that you think would have been helpful for this group, then please share so that we can maybe bring that value here to this space. Okay, great question from Cameron in the chat. Would it be okay to share the poll with the meeting participants, and then we can see what was shared? Is that something you're able to pull up, Martin?
Yeah, I think so. So if we're ready, it
Awesome.
looks like most folks have submitted, and then we do have that link if you didn't get a chance to submit feedback. But I'll go ahead and end the poll now, and I think I should be able to. Yeah, here we go. So folks should be seeing the results of the poll on their screens.
So most people have been involved with between 1 and 3 years, so an intermediate length of time. Um, Many case managers and others around the call. What populations most people worked with? Adults and families, not too surprising. And then by a long shot, I'd say the type of presentations that people prefer are community resource sharing. So that's really, really helpful information. If you or the agency you work with have any new resources coming down the pipeline or things that you think would be valuable to this space, please feel free to reach out. I know each meeting, usually at the end, we say, hey, reach out to me if you have ideas or would like to share. But really, I am trying to encourage you all to reach out if your agency or some of the work you do is worth a share out. So I think that covers everything. Please feel free, Adam or Martin, to unmute and add if you'd like. If not, we will move on. Go ahead, Cameron.
Thanks. I wanted to kind of uplift and respect those in the room, especially when you're saying that like so many people included community resource sharing, is that a lot of times, especially since there's a lot of case managers in here, that uh, we are gathering so many of those resources, and we become experts in those resources too. So just because we are the ones that have collected that resource doesn't mean like we can't be the ones that also share out those resources. So kind of in that peer-led topics presentations, kind of just keep in mind that you know what you're doing and you know the resources you have available to you, and that is still worth sharing as well. Like you don't have to work for like ODHS and be like the one that presents ODHS information. You could be like, I've helped so many people with this stuff, and I could help people kind of navigate this from my perspective. And that is also worth sharing as well. So whether you feel confident, maybe team up with a coworker or a supervisor to kind of take that leap of faith that like you can be in front of a screen and share your knowledge because we all benefit from that as well. So if you could pass that along.
Thanks for the feedback, Cameron. Back to you, Adam.
All right, thanks everyone. It looks like we did not receive a public comment for this meeting, and so we're going to go ahead and just pivot to our announcements, including a training survey due June 8th, link to be provided in the chat. Lindsay, did you have anything you wanted to add to that?
Not necessarily. I guess that's me again. Many of you may have already received and completed the survey. Um, it's probably 15 to 20-minute survey. There are several questions, but it's really helping us gauging the landscape of trainings and needed and desired skills and topics similar to what we're talking about here today. So if you have a few minutes, I would really encourage you to take the time to complete this. Next steps are we are really going to be working with some consultants to design and deliver some of these trainings into next fiscal year. So again, please be encouraged to complete that if you're able to.
Great, thank you. And again, you can see the link there in the chat for that survey. And then Nadia, we'll again pivot to you for the Hiss and Digest.
I will
Yeah.
go. Oh, go ahead,
Okay.
Nadia.
Sorry. I feel like this is a continuous thing for me. I'm getting over another cold. Um, but so I'm gonna paste in the chat a little blurb that I typed up about what I'm sharing. About the digest, I wanted to let everyone know that we're moving to a schedule where we aim to have it go out on the second and fourth Wednesday of the month. We try to include things that we think will be relevant to this audience. So there are workshops, trainings, jobs, resources, any other announcements or events that seem appropriate. So if you have anything to share, please email the Homeless Services inbox, which I've shared in the chat. Um, and also, I just put in a few pointers about how to make sure that we have all the relevant information. If some of you are familiar with the 5 Ws, like the who, what, where, when, why, it's just so that we have all the relevant information. And if there are attachments, to make sure that they are legible and that they are in a PDF form so that that's the platform that we use, that's what we can attach more easily. And then if there are any questions, you can reach out to me if you're not sure if something is appropriate, or if you just are struggling with creating the forms and things like that. I know that's sometimes tricky. Just let me know.
Great, thanks, Nadia. And to kind of piggyback on that, kind of seeking information that our network has. That's one of the reasons that we're together is to share best resources. But if you or your agency would be interested in offering a presentation during this HISN meeting, please reach out to Lindsay. I know she's always open to finding new voices in this space that help empower us. Okay, so a couple last minute things. Just a reminder, no meeting in July. The first Wednesday of July will not be meeting. We'll be back in August. And then lastly, just want to open the floor. If you have any events or kudos or highlights from your agency that you'd like to share out, now's the time to do so. Otherwise, this is the end of our time together, and we'll be back the first Wednesday of August.
I'm going to send to the homeless services, but Community Connect has a position open, and so I'll add that to the digest. I'll send it over with the link and everything as well. But yes, Community Action has an open position on our Community Connect team. So that's the only announcement I have. Also, I'm Allie. I'm the supervisor for Community Connect over at Community Action. So hello.
Thanks, Allie.
Hey, this is Matt with Just Compassion. I just found out yesterday in our staff meeting that our shelter will be listing a couple open positions here shortly. So if you know anybody looking for a position at the shelter, please keep that in mind.
Great,
And that's
appreciate
at
it.
the Tiger Shelter.
Great, thank you. Well, thanks for being here, everyone, today, and hope you enjoy all those plans that you put in the chat at the beginning of our meeting. And yeah, have a great summer. We'll see you in August.